Good morning. Good afternoon. I don't know what day, do you know what day it is, what month it is? I looked at the calendar today and said April. I'm like, isn't that next month? Everything's, why can't we just postpone a month and then redo it? And that way we could just, because I don't know how many of you know that there's an actual time machine in this building, right? There's an actual time machine. And maybe later, I don't know if I can do this, but at some point I will show you the time machine right here on our show. All right, let me just cue up one more thing here, and then we'll get to work. By the way, my name's Dean Mazzarella, the mayor for the city of Leominster. Thank you for joining us this afternoon on our 4 o'clock update. We try to share with you what's happening in and around the city and how this all applies to you. So we take all the information all day, and hey, that's me. There you go. And we take all the information that we gather all day, and then we try to sort of strain it through, boil it down so that we're sharing information with you that's local, because you can get so much other information out there, but is it really local, right? Even the newspapers are giving information as fast as they get it, but it takes a whole day to print it, so they're getting a day or 2 day old information, and we give it to you right here. We'll do the COVID patient census hospital by hospital as of yesterday, if you're interested at all. And so hotspots, Beth Israel Deaconess in Plymouth. I'm sorry, that would be Beth Israel Deaconess Medical Center, Suffolk County, so that's Boston, with 250 cases hospitalized. Boston Medical with 269. Brigham and Women's Hospital with 199. Let's see. Clinton Hospital with 2. Emerson Hospital with 38. 95 at the Good Samaritan Medical Center in Plymouth. Holy Family Hospital in Essex with 56. Leahy Hospital in Burlington, 137 cases hospitalized. And Mass General Hospital with 452 cases confirmed, and that includes ICU. And let's see what else is notable. I guess we missed our own. Health Alliance Leominster with 18. So that's 18 hospitalized COVID patients suspected or confirmed, and that includes ICU. So that's Health Alliance Leominster. According to this, this is put out by the Massachusetts Department of Public Health as of yesterday. And again, Haywood Hospital, I'm sorry, is it, what? Yeah, Haywood Hospital. That's not Henry Haywood, right? What's the hospital in Gardner? I'm trying to find it. Anyway, Athol with 0 cases, they're reporting. Athol with 0 cases, and I can't find the Gardner Hospital. There's a Haywood, but it says Worcester with 11. So I don't know. They put out an update every day, and I didn't see it. So anyway, other places, UMass campus in Worcester with 104 cases. South Shore Hospital with 145 cases. Newton Wellesley Hospital with 94 cases. And these mostly are in Suffolk or Essex County. Again, Mass General Hospital, 452 hospitalized COVID patients and suspected and confirmed, and that includes the intensive care unit. So those are pretty much the hot spots. And yeah, I don't find the Gardner Hospital on here unless they have it under Haywood. I don't see it. Boston Children's with 12. And so Boston Medical with 269. Brigham and Women's, again, 199. And Cambridge Hospital with 91, 89 in CAMA. Yeah, Haywood Hospital. But they have it under Worcester, David. So it says Health Alliance at 18 and Haywood Hospital in Worcester, which they give a zip code of 01440. So I don't know, is Worcester 01440? Anyway, I think that's Gardner's zip code. Anyway, thank you for joining us. Again, we take all this information. So this morning, we were trying to get a read on a couple of things here. That being, we look at the COVID case confirmations, we try to look at other communities our size, just a matter of taking numbers and sort of taking a look at them. Some people are interested, some aren't. And so we were looking at two communities, Chelsea and Everett. Chelsea, right now, as of last Tuesday's cases, we're at 1,447. They had 90 deaths. As of Friday, though, they had 1,500, so they basically went up 58. So we're trying to understand the whole shelter in place. In fact, I think in Everett, no, I think in Somerville, it's like a $350 fine if you're seen not wearing a mask. But trying to look at whether or not this whole shelter in place really works. And they're still seeing, both in Chelsea and Everett, Everett is up 122 in 3 days. And again, population-wise, Everett is about the same size as Leominster. They have 716 cases compared to our 127. Now, this is comparing, it's gone up, Leominster and Everett, but that's as of Tuesday, Wednesday, when we look at these populations. So Salem, Mass, same size as us with 277. Marlborough with 299. Watertown, 163. Fitchburg, as of last Wednesday, was at 148. We were at 127. So just trying to understand the numbers here and whether or not the shelter in place, you can't even get a school lunch in Everett, whether or not that made any difference for them. And I'm not saying here, I'm saying for them, they're much more dense than we are, same as Malden and some of the other communities around there, very dense. Chelsea, I know well, very dense, with 39,000 people at 1,447 with 90 deaths. So clearly that's something to take note to. Just to show you, we did a quick graph here, and this is Worcester County cases. Let me just, I may as well, if you don't mind, I'll do some of the slides. Can we do some of the slides? I don't know if we have this one on here, so I'll just keep this one up for you for now, if we can leave that up. But Worcester County cases over the past month, sort of done this up and down, almost like M's, gone up and down. Can you just give me a shot here and I'll show it, because I'm not sure that we have that slide. But anyway, you can see here, starting here, sort of at the very beginning, this is March 21st, you get that little bit of a zigzag, and then you get some spikes, and then it drops, and then you get some drops, and then spikes, and then down, and then up. And then you see this big spike here last week, which was what we were calling the surge. You want to zoom in on that? I think we might have it in here, but just for the sake of, so you can see that. So there's the big spike last week on this side here, right? So there's the big surge, right, for us here in the, so you can see it starts out in March, and then we get those up, and it goes down and up. And a lot of that has to do, I think, okay, thanks. A lot of that, I think, has to do with testing, but just since we get this information, we just figure we put it together and share it with you. And now back to our slides. Important phone numbers here, there they are. Everything you see here is on our Facebook and our website, leominster-ma.gov. Yes, you should, listen, if you're gonna go out in public, I would wear a mask, or the safest thing is stay away from everybody, right? Just stay away from everybody. There's our important information. Emergency Management Center is still open, 978-534-7500, extension 5055. They've been out in the community delivering lunches today. They're busy, busy, busy. They bring all the lunches for the school children over to Silverleaf, and as well as they bring them over to Riverside Apartments, and then, of course, they make some deliveries. They're also teaming up with Ginny's Food Pantry to make deliveries to the elderly. So everything, all in all, I was on a number of phone calls today with those from outside the area wanting to know how it was going here. And I would have to say, overall, things have gone well, as smooth as I think things could be. Anyway, 211 for the state hotline for emergencies, 911. Mott is still giving out rides to the elderly, but you do need to call, 978-534-7511. And they're still doing quite a few calls up there, as Lorraine has said. Most forms are online. You can do much of what needs to get done for the city can get done online. So if you need anything and you cannot find it, you get frustrated working your way through the sites, call us at 978-534-7500 and we'll walk you through the process, right? We don't want you to get frustrated. Just call us. We'll get the form. We'll download it for you. Whatever it takes, we'll take care of it for you. So we don't have the updated numbers today, but we will. Wendy will, there we are. Let's see. Let me see if I can get those. But you can go ahead and take a look at those, and I will try to get you the updated numbers. Okay. So let's go to that slide because I'm going to reference yesterday. So total cases yesterday were 54,900, so almost 55. Today they're up to 56,462. That's an increase, not quite the increase that we saw yesterday. It's actually a decrease. I'm sorry, it's a decrease of down to 1524. It's not a big decrease. It's 70, but it is a decrease. Worcester County, testing positive in Worcester County, 4,744. That's total since day one, and it's up 172. So you can see we went from 474 to 5. So we went up about 100. It didn't go up that much. In fact, it looks like it went down. So it's up from previous, but it's actually down because Worcester County today is reporting 4744, and they were reporting yesterday at 4572. So that's a reduction. Total tested in Massachusetts, about 244,800. So let's just say 245,000 people. And the testing has gone back up to 8,785. So it's about where we were yesterday. And then total deaths in Massachusetts has gone up, unfortunately, has gone up about 104 to 3,003. So they're over that 3,000 level. So the more testing, it doesn't make any people safer that are in dire straits and in critical condition in ICU. But it does show us that more testing is identifying more, get hospitalized, who needs to be hospitalized, and then obviously those that need to be treated outpatient are treated outpatient. So hospitalization rate remains at 7%. So that's level now. That's pretty much leveling off. We have, let's see, so 90, we don't have the local numbers yet, do we, Wendy? I don't see the local numbers. So in Leominster, we went up, from Saturday to Sunday, we went up 2 cases, but stayed the same on off isolation. So people wanted to know, I keep reporting it as removed, and so I'm trying to use one word that explains it all, but every one of us interprets it a little bit differently. So the only way that I can sort of explain it is that once you are quarantined and you are removed because you're quarantined, then it still might be the situation where the physician may say, you still have some symptoms? Yes, I do. So you may still need to be quarantined until those symptoms go away, or 7 days typically, and then actually you can return to work. And if I'm incorrect, let me know, but that's my understanding. How many people live in Leominster, or how many people are affected by, I'm not sure what the question is, but right now about 45,000 people is the last census, and that's a local census. So that's how many people live here, and I don't know the percentage of those who are testing positive. But again, my real wonder is how many of those that are being tested positive, and out of that percentage, we know that 7% are hospitalized, but out of that percentage, how many that are not hospitalized have no symptoms? Because that really tells us that we have to go above and beyond. If that percentage is like 90%, or even if it's 50% of that, that means that's 50% of the total amount of people that have COVID, that have the coronavirus, that are out in the community that don't know they have it, which is, if you look at the CDC website, the reason they say that you wear a mask, the reason they give for people wearing masks is so that you don't give it to somebody else. That's what the CDC website says. You can check. But it says the purpose of a mask is so that you, in case you don't know you have it, don't give it to somebody. Now, obviously, the best thing you could do is to either shelter in place and that place could be your home, or when you go for a walk, you're kind of like me. I'm just staying away from everybody as much as I possibly can, and there's nobody getting within 8 to 10 feet of me. So I'm not giving it to them, and I'm not getting it from them. But that's the purpose of of having a mask, according to the CDC. So there's those cases. There are communities, all those communities there are like-sized communities, and this is as of Wednesday, when they put the COVID cases similar populations, and they're just getting hammered in Chelsea and Revere and Everett, and then it drops down to the 400s as you get into Weymouth and places like that, into the 300s, and then that next column to the left, as I look at it, and Bill Ricker and places like that are 261, and then it drops down. Clearly showing the more dense the population. Other than Marlborough is a little bit confusing, and I talked to the mayor last week, and a little confusing as to why they're up around 295. And even Attleboro, which is pretty much not a densely population. I've been there a number of times. It is not. But when you get to, and even Westfield, but when you get to Salem, and you get to even Taunton and Weymouth and Peabody and Methuen, not so much. They're kind of like us, spread out. Braintree is very dense. Holyoke, because of the soldiers' home there, but dense. Randolph, dense. Everett and Revere and Chelsea, all dense. Clearly, I think showing that the more dense the area, the more likely. Yeah, Larry, the Amherst is our size, but they closed school like 2 months ago. And mostly the colleges are out there, and that's a big part of their population. So that's probably why Dartmouth and Amherst have low numbers. Andover is, just a different community, right? Spread out, a lot of acre zoning in Andover, half-acre zoning, acre zoning, little downtown, lots of coffee shop. I don't understand that. It's a whole nother subject. But anyway, that's the comparisons. And then you get down to Barnstable and the Cape in that area. So the numbers mean, I don't know. There's no science behind it right now. It's just a matter of trying to understand what's going on around. Okay, Wendy did pump this up. Thank you, Wendy. So there's the graph. You see back in March on the 21st, not that, this is Worcester County. The cases start, and we start talking about sort of school closures and how long that would be, and things are we're starting to get the message that this is serious stuff, and it doesn't quite look like we're going to get it. And then, the New York gets sort of really gets hit bad. Washington State, some other places really get hit hard. Baltimore starts to kick in, and Philly starts to kick in, and the bigger cities. So now we're looking at it saying, yep, that looks like what it is. But here's Worcester County for the most part. And, Worcester is dense, and you get to Fitchburg and Leominster, not as dense. We're both, 30 square miles or more, so not that dense. But then you get into the little towns, and that tells the story. So Worcester County, there we are, and then as of April 25th. So there we are on that sort of the surge from the 22nd on to the 25th when we confirm those cases. But again, a lot of that is testing. So whether or not the science, those forensic people behind the data knew that, based on what's happened in other places, the more you do the testing, that's when you're going to find the surge. The surge, I don't think, was necessarily that we're going to see increased cases. I think some of these people have had it. And so we might not necessarily have seen the surge in cases, but the identifying more cases through more testing. There we go on our daily and cumulative confirmed cases as of yesterday. So you see sort of that peak around April 23rd, somewhere around there. And then on April 26th, you see, each day it's gone down in terms of the confirmed cases. But but what does that really mean? I'm certainly not going to draw any reference to that. As you see the sex count up there in terms of male-female ratio, it's about even, right? Pretty much even. Testing by date, again, if I showed you side-by-side slides showing you how many people have been tested and the percentage of those testing positive, it would look a lot like we've been discussing, right? 7% become hospitalized, and the rest are basic, some with no symptoms, only found out because of tracing. They've gone back. So, for instance, somebody that I know was tested positive. So the testing now and the tracing will identify that person, ask them who they've been around, and they will ask if any of them have symptoms, and they will sort of go a little further. The investigation will go a little further into whom maybe they came in contact with, and again, they probably would be tested. There's the county. You can't really see it, but if you look to the left there, Middlesex County, Suffolk, Essex. Again, I can't tell you, even when you get down to Worcester, because after that it really becomes, you know, it's not as dense. So you don't have that population. You don't have the trains and the subways, you know, people walking, you know, shoulder to shoulder on sidewalks, that sort of thing, sitting in coffee shops waiting for their order, of food places. You know, the more urban locations seem to cram in as many tables as possible to get as many people in revenue as they possibly can, because the high cost of doing business in the inner city, that obviously is going to change. But I think that's one thing that we can draw as a conclusion. But again, that's just for me looking at the numbers. It means nothing. If those other graphs mean nothing to you, then take a look at this, the light blue, not the lightest, but the medium blue, I guess you would say, the Leominster blue. Is that Leominster blue? Is probably less affected with Bristol County. But again, there's those urban centers, those real urban centers, and that's where you've seen the biggest part of it. And then Hampden County, but I think Hampden might have been where the soldiers' home was in Holyoke. Not 100% sure. And then you get into the Berkshires and Franklin and Hampshire, and you see very, very minimal cases out there. And that's, again, based on the rate per 100,000 confirmed. And that is of yesterday. Hospitalizations currently, and I gave you that hospitalization number a minute ago. I'll read to you towards the end of this, but we were at 3,008. So just say, you know, 3,900 that are hospitalized. There are 18,500 beds, I believe. Let's say that as an example. But those are not, in another slide I'll show you, those are not all set up for ICU, though. And that's why, you know, there might be 7% who are hospitalized, but how many of those are in critical care, in acute care or intensive care? I don't know the breakdown of that. There's your deaths and confirmed cases. We're over 3,000 now. Clearly, you can't sort of say that testing helped that. Deaths are going to be a result of serious illness. And so that seems to follow the reported, those that test positive. So there is some connection to that in terms of testing. So it's not just we did more testing and we found more people with the virus. I think it's either that or it's a connection. You math people that are out there, you do a much better job figuring this whole thing out. But anyway, there it is. There's the curves. And the average age for those that have gotten the virus, if you look, when you look at by age group on the left, it's pretty much, when you look at it, even the 80-plus year olds, it's pretty much across the board. Not that far off. In fact, there are, if you look at that age group 50 to 59, they've actually higher than those of 80-plus years old. And look at even down into the 20s. So people keep saying young people don't get it. That's not true. They do die from it, not as much as somebody that's in their 80s, the likelihood, but they do get it. But his starts to tell the story to the right. And when you go by age groups per 100,000 confirmed, now it starts to make a little better sense. The average age, 54, which is kind of strange because I don't hear of those cases where people are in their 50s. If you look in the obituaries or whatever, you kind of look into the Globe and the New York Times and even locally in the Telegram, I don't see that average age, but again, that's depending where you are. So let's look at hospitalization and rate by 100,000. If you look to the left, starting to make some sense, right? The older you are, the more serious the case, the higher percentage you have in that age group of being hospitalized. And then when you go the rate per 100,000 confirmed, I know the stuff might get a little boring, apologize, but just trying to make some sense out of it. Now you get to that hospital rate by age group per 100,000, and now the average age on that is 69 years old. Starting to make sense, right? Now we get to the next couple slides, and this really makes sense, right? This really does. This says it all. This, if you look to the left, and we're looking at deaths by age group. So yes, people have said people in their, in their 20s or 30s, but really look at the numbers. 20 to 29, 1. 7 at 30 to 39. Not that we want to see any, but I keep hearing that, oh no, people are getting this and they're dying from it. But really, look at the numbers on the left. Those are confirmed cases as of the April 26th. So I don't know if somebody has, I keep seeing it on Facebook where people say, people don't think that young people are dying from this, and they really are. There's a lot of people, and like they've even quoted certain hospitals where people that say they work there saw 6 to 8 cases in one day. And that might have been the bigger hospitals, but look at, unless this data is incorrect, when we get to the deaths, we don't even really see it. We go from 23 at 40 to 49, and then from 50 to 59, it peaks to 100. And then we jump up to only and I don't want to say only, but to 278. But look at, this really tells the story here. When you get to that age group, it really goes from 70 to 79, and then 80, it just takes right off. So I got 2 more slides here, which will help make sense of all this. But the average age of those confirmed cases of COVID-19 and the virus are at the average age is 82. And then cumulative, let's see, did I go ahead? Let me just jump ahead. I was trying to look for that other slide. There's another slide that shows total cases hospitalized. Let's see, maybe it's just in a different order. Let me just go. Okay, it's not on here. That's okay. I think I had them removed. But I guess that what I wanted to show you. Okay, this is the slide here. So this sums it all up to me. Might not be for you, but it sums it up. So we looked at those other slides. We see very few young people dying from it. Again, I'm told often, I read often that they are, but you just saw that slide. Let me go back. Right there. Clearly they're not according to this. And even when you get into the rate per 100,000 in those age categories, to see any kind of significance, 1 is significant, but to see any kind of significance, you really got to jump up because you're at like 3 at the age group of 40 to 45. Doesn't mean you're not sick and real sick and close to death and have some lung and heart problems after this is done. But we're talking about deaths right now. You don't even see it jump up until 11 for the 50 to 59. And even then, the 34 age group right there. So where all these reports are coming from, I'm not sure. I can just tell you what the state is releasing. But it does jump up significantly for that 82 plus year or that 82. Now let's jump to the slide because this tells you it's split between deaths are split between male and female. Remember I showed you the slide on who gets this virus, equally split. Deaths with the previous hospitalization, so that could mean anything. I think it's a box that says, were they previously hospitalized? I don't know, could be a year, 2, 6 months. I'm not sure what that is, but there it is. It jumps up to 58, almost 59%. And then the real telling story here is deaths with underlying conditions. So I've heard physicians say, yes, people have a series, like multitude of other pre-existing conditions, and they come here and they get the virus, but it's listed as the thing that killed them was the virus. But there are so many other factors there. It's hard to tell, and somebody will be sorting this all out later. But look at that, 98% had some sort of underlying condition. So, that's it in a nutshell. Racial diversity, clearly. There is cases by race, and you clearly see it's 54%. Could be a cultural thing, could be the fact that for many of our ethnic community, they work in the nursing homes, they work in hospitals, they work in the public service end of the business, they are work in grocery stores, factories, all of those businesses that have been listed as essential. That may have something to do with it. I'm just casting on some fruit for you to sort of chew on. And total cases reported as hospitalized, 5%, and then total deaths are responsible for 50. I'm sorry, I read that wrong. For cases reported hospitalized, that is a high number, 40%, and those deaths by race is 51%. So that's pretty high if you take the total amount of deaths at 3,000 and look and think that 51% of those. So again, workplace culture may have something to do with it. I'm not sure, but we'll sort of be studying some of this stuff, I think, for a long time. My name's Dean Mazzarella, the mayor of the city of Leominster, and yes, and I am here every day at 9 in the morning, and I put lots of gel in my hair to comb it down, but I really look like pretty bad, like I stuck my finger in a light socket. And then in the afternoon, we meet at 4 o'clock in the afternoon to give you updates. So the question is, what about some companies that are lay off employees who decide to stay at home to protect their health, and agreement with them to return? I don't know. I don't know if there's a stay-in-place order so that if you say to your employer, I have pre-existing conditions, I think they have to try to make reasonable accommodations for you, is the way. I'm not a lawyer, but I'm just sort of sharing. Gigi, what's the weather like where you are? I know, I hope it's warm, because it's rainy, raw, and cold here today. But most businesses are required to make reasonable accommodations for you if you're an employee. And that could mean a lot of things. That could mean that you're off to another section away from people. It could mean that you're brought into another office. But that's something you might be able to find in legal assistance. I'm not sure. It could mean a whole lot of things. But there's also the Family Medical Leave Act that you can take advantage of. So if a person feels that they are not, that they're in an environment where they're not safe, or they have another pre-existing condition, or there are no masks, whatever it might be, there are laws that were passed to help them to be protected. Let's see if we have any more slides here. We have a ton of slides here. By region, total bed capacity, I said 18,300, is it? Bed capacity, and we have just under 4,000 hospitalized, but again, that could mean a whole lot of things, right? That could mean they're in ICU, there could be in acute care. There's so many different variations of this. And again, we haven't even had the conversation yet about, this is PPEs, if you want to take a look at it, personal protection equipment. We haven't even looked at the fact that just because somebody doesn't die and they're released from the hospital doesn't necessarily mean that they're in, that they're in great shape. They could have damage to their lungs. It could be permanent from being on a ventilator. So yeah, they are alive, but nobody has we don't have categories to and columns to put them in. They may need even permanent medical treatments for the rest of their lives. So when I was talking a little bit, and we'll get back to the numbers, but just remind me if I stray off here. We were talking about what does it mean when you're removed from the list. So the total amount in Leominster was 90 cases, is 158 cases total since we started, since the Department of Public Health started categorizing these. And then out of that 158, there are 68 off. And so I keep having this conversation, just had it last night. So what does off mean? So I think what I touched on a minute ago, it means that off means without symptoms. So you've done your 14 days of self-quarantine, and now you are 7 days, I think is the magic number, without symptoms, and then you're actually allowed to go back to work, again, excuse me, keeping your social distance, a mask, all of that. So there are requirements. Again, CDC, I don't want to pretend that I know all the answers to this. I try to read up and catch as much as I possibly can, so I apologize, I'm misinterpreting that. So that's what that means. It means that there are 90 active cases as we speak today, as of yesterday, and there are 65 off of that. Now, that could still mean that you have one or two, that you still have one or two of these symptoms. And as far as I'm concerned, you're still on, but they're saying 68 off when you don't have any symptoms and you haven't had any symptoms for 7 days. So I hope that clears it up. Did I make any headway there? Because I know I've confused people. I've put 90 cases active, but then I'm like, well, how should I word this? Off isolation. What does that mean? Removed. Some people said, well, does remove mean that somebody passed away and that's why they're on the list? And I don't know, we haven't received any deaths here in the city of Leominster. And remember, how this is categorized is really by the community you live. So you could live in you could work in another community, but it's really going to be reported in the community that you live. That's the only way that they categorize it, that they can make it equal across the board. Otherwise, it'd be impossible to track who works where and whether they have a part-time job in one town and another part-time job in another town. It would be too difficult to tell that. Testing, testing, testing. More going on. If somebody can find out in my office, if they're watching, when we get on the conference call, how many tests on average they're doing at Health Alliance and whether it's up or down, are they testing more than ever? One thing that they're not doing is requiring a doctor's note, but you need to have some symptoms. And those symptoms need to be a temperature of 100 or more, a cough, new or worsening shortness of breath, loss or change in smell, and confirmed exposure to people who, so those would be confirmed exposure to people that had COVID-19 or had symptoms. Now, the Center for Disease Control has added to the list. So check the Center for Disease Control. They've added chills, shivering, sore throat. If you remember, they had those on the list. And I remember hearing those every day from these doctors that get on and sort of part of the press conferences for the governor and everyone. And then I didn't hear about them anymore. I'm like, what happened to sore throat and chills and all that? And I suspect that probably everybody had either one and thought, yeah, I think I got it, and we'll call them to get tested. So maybe they removed that and said these are the most important ones. But you do not need a doctor's note, but you do have to have symptoms. And if you do have symptoms, it's 8 to 4 o'clock at Health Alliance Leominster campus, Monday through Friday, and then 10 to 2 on the weekends. And I'm curious as to what the response has been on the weekends. And at RELIANT, if you're experiencing these symptoms, same thing. Call RELIANT, talk to a physician or nurse's assistant, doctor's assistant, and they will get a nurse practitioner, and they will get somebody to speak with you. They'll qualify you for it and then get you off to the test. I think in the coming weeks, more and more people, they'll start to loosen up the guidelines on who can be tested, and they'll get to the most vulnerable. They get people with pre-existing conditions, maybe even if they don't have symptoms, and they'll just keep going down the line until they can get us pretty much all tested. Whether that'll happen, whether you all get tested, I'm not sure. But testing, right, is simply the way that they've told us that this is the way to open things up, right? Everyone will run around with a certificate that said I was tested. And here's my results, so let me in. News from the state. Nursing homes have been the hot spot. It's what we've been saying here right along. State has put a long-term team in place, 60,000 residents in long-term care facilities. Remember, at the very beginning of this, what we were hearing from places like Italy and China was that one of the biggest problems was that the hospitals become overrun and can't not handle the cases. Remember, the state plan set up a temporary morgue. One of them was in Fitchburg to open the DCU center so they could get people out of the hospitals faster. Remember, that was the big crisis here, was not having the proper health care system in place. And yet, on the other end, more people were dying in nursing homes, and that's not any kind of reflection on the care that they get at nursing homes, because there are many nursing homes that do a great job. But I think it's a reflection of the fact that they overestimated on, and this isn't being critical to anybody, this is just sort of my read on it, they overestimated the burden on hospitals across our state and underestimated the burden where the highest and most vulnerable population was. That's not the Monday morning quarterback it or Monday afternoon quarterback it. That's just to bring up some observation. So I suspect that when we sit down and have these meetings, these follow-up meetings later on to look at what went well and what didn't, I will tend to tell you, and I will suspect that high on the list will be what happened at these nursing homes and at these soldiers' homes. What happened, and shouldn't we have activated teams of people to get into these healthcare centers immediately at the same time that we were deploying people and money and staff and all of that and testing everything, PPEs and everything, we were deploying on one end, And next time, would we do it differently? I'll bet you the people in power would say absolutely. That'd be we would do it simultaneously. As we were ramping up at the hospitals, we'd be on Section B here, which would be on the same level as ramping up nursing homes and assisted living, and certainly those poor soldiers in those soldiers' homes. So we've got that. So here's some of the other things that are happening. PPEs, more arriving in the state, more testing going on, another $130 million available for long-term care facilities. See that there? They're adding to the long-term care facilities, and another $34 million for residential service providers. So this is good stuff coming from the governor and the lieutenant governor. They get it. They see what's going on, and they're responding. Hasbro of East Long Meadow will be making 50,000 face shields per week. 400 businesses, and I'm happy to say a number of businesses here in Leominster are working with the state to make COVID-related items rather than what they were really making, right? And PPE, $6.5 million have been distributed. We are the center for the region for the masks for police and fire. And people will say, well, what are the people in the healthcare industry? That's Department of Public Health. So this system was set up just for police and fire. They processed 100,000 claims under the PUA, self-employed claims, and I'll talk about that in a minute as I get to that slide. Here's some things that are happening in the city. Transfer station is closed on the weekends. Shoalin Farm is closed from 5 a.m. till Wednesday. They're spraying, so stay away Tuesday and Wednesday. And Leominster tax information, taxes are due Friday. If you can't pay and you have a little bit of a difficulty, give you an extra month. No extra fees charged. Please remember that the city has a financial obligation too, and we'd like you to pay if you could. And if you have any other bills after March 10th, water bills, excise tax, etc., then we're giving you till the end of June 30th to pay, and again, no extra fees. And if you would like to be really hippie, cool, fashionable, you can pay online, leominster-ma.gov. You can also mail it. That's a cool thing because you keep the post office in business. And by the way, all those letter carriers out there, we've had like one nice day, 3 bad days, one nice day, 3, and they do between 8 and 13 miles a day. That's how long their routes are. And I saw them out there today. They're drenched, and some had hats on, and the water was just sort of coming down their hat and dripping off their the brim. And you know what? Tough work out there, right? Part of the team, part of the essential workers. So a big tip of the hat to them. Don't tip it because it's waterlogged, but on a nice day, a tip of the hat. So grateful for them. And one more time. So did we forget anything? Oh, and then if you want, you can come to the top. Stop at City Hall 24/7. You can march up, watch up, pull yourself up them stairs, get to the top of the stairs. You see a mailbox. Click, put it in there. You can listen to the old-fashioned bang. You're never going to hear that sound, that sound of a mailbox. You know how you pull the handle down, you let it go, and there's that bang? Everywhere in the country, that is the same sound. You realize that? Well, they've done away with those mailboxes. And they've got these little slots so you can only fit in a few things, the old explosion and bomb-proof sort of things. You can only fit, like, if you squeeze 3 or 4 letters together, envelopes, you can squeeze them in. But the old days, you'll never hear that sound again unless you come to the top stairs at City Hall and use our mailbox to deposit your bills. Okay, moving along here, burn permit. Tomorrow's supposed to be nice? Yes? No? I don't know. And if it is, then you can call the fire department. They'll give you a burn permit. Don't do anything that's crazy because just not going to work out, right? Yeah, just common sense. I read all these things, but it's really common sense. You could call anytime between 10 and 4. No, that's when you can burn. But you need to call no later than 2. No permits will be granted after 12. Okay? All fires got to be out by 4. Right? But definitely, just common sense here. I feel bad for telling people not to dump 5 gallons of gas, but that's like common sense. We're moving right along. In fact, too fast. Comcast Essentials program. That's only going now until the 30th. So get on the phone. Call this number, 855-846-8376. They will give you free, if you qualify, and there's what you qualify for at the top there, school lunch program, SSI, SNAP, all these things. Subsidized housing. They'll give you free internet for 2 months, and then after that, it's $9.95 per month plus tax. So there's the number. Don't let it go by, 855-846-8376. Yeah, if you've been anywhere busy, better to go in the afternoon if you can, but they have less of a selection. But if you're going to big box retailers, I'd say go in the afternoon or mid-afternoon. Other than that, you'll be out line, and I don't know. Like I said, I'm staying away from peeps, and I'm not going to risk getting within 6 feet of anybody, so I'm not standing in those lines. Just going to keep going. I'll go back later. And I'm going to go past those. Oh, let me see where the next slide is for the PPUs. Okay. Boom, 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 boom. I might have gone by it. Okay, so the state's website for stimulus for those who have a business and you are self-employed, so hairdressers, I don't know, they call them here, salon, nail professionals, hair professionals. Everybody's a professional. Whatever it is, you have a profession. And if you operate your business and you're alone, it's just you, right? You are a plumber, whatever it is. You are self-employed. Go to Leominster. Go to mass.gov / is it D? Let me see what it is. I got messed up in my slides here. It's my fault. It's D. Is it DUA? Yeah, it's DUA. .com. So you go to mass.com, mass.gov / DUA. And that you can apply for those fundings. But also the federal stimulus money. Remember the money they just passed last week? They have opened up. Let's see where that is. Okay. They have opened up that site, so you can go to the SBA site. They've opened up for that $310 billion. So just opened up today. So get moving on it. Get on the computer. Don't waste any time. This is for you. This is aimed towards small businesses here. And 100,000 people applied for that other program from the state. This is the federal, and you should definitely be applying for that funding. Now, if you're somebody that has a difficult time and you're not applying for these things, these loans and grants, and you're a business owner, because if there's a language barrier and maybe your language isn't so great and you're feeling a little uneasy, you shouldn't. You should really apply. And you can go to empowersmallbusiness.org, and they have it in, let's see, how many languages? They have it in a lot of languages, and they have it in just about every language. So this is really a big help to you and your ability to apply for these grants, and you're eligible, so do not let that be a barrier. Stimulus checks, you should be getting them. If you're not, then I would wait another week if you're on the list of those who have it mailed to you. Because I still haven't heard. Is anybody out there getting those stimulus checks mailed to you? I know that most of them were automatic deposit. Did anybody get them? If you can, just post it on my Facebook page and let me know if you received your stimulus check by mail. That would be helpful. And don't forget, we are doing a contest to see the person that could rake up the most amount of leaves and put them in bags. Last date is the 30th. Send an email to my office, to me, dmazzarella@leominster-ma.gov. And the person that wins is going to win a free fall cleanup from, let's see, Turf Tender. Global Gym is going to give you a gift card. American Harley Davidson, Central Flag, and the Claw Shop. Those are all people who are part of this. So get those leaves raked up, get them in a bag, take a picture, and send them over to us. Anybody get a check yet? My dad didn't get his yet, and it was supposed to be mailed. Okay, let us know. Just jump in at any time and let us know, whatever session we're on, if anybody is getting their stimulus check by mail. Registry of Motor Vehicles, 1-857-368-8000. They have a great website. Go to the website first. It's mostly commercial licenses that you'll have to go for, but if you have a question, they're given 60-day extensions on licenses, 30 days on, 60 days on number plates for stickers, and, right, I mean, it's common sense here. And if you have any questions, 857-368-8000. The Leominster registry is not open. And we thank McDonald's. They want to give you a free meal for first responders. Stop by a participating McDonald's. Ours is 302 North Main Street. They give you breakfast, or you can have lunch. Must show valid ID, proof of list of a first responder, and it's valid till 4/22. What? Till 5/5. Okay, from 4/22 to 5/5, and ask for the U meal. So when you go there and they say, "Can I help you?" No, this is what they say. "Can I help you?" It's like, "Yep. Give me the thank you meal," and then they'll ask you for some verification, a badge, something, I don't know. But just their way of showing thanks to you and all those first responders. Okay, we're going to run out of time, so I'm going to have to leave you right there for Dr. Mazzarella's boot camp. I don't have my stethoscope, but I look the part, right? And I just want to remind you that assume that you have the virus, everybody you come in contact with does. Assume that all the surfaces that you come near, touch, are somehow or another compromised, and wash your hands and stay away from people. Okay, let me just give you the numbers for today for Leominster, because we didn't have them right away, but Wendy was quick to get them off to us. So here we go. So Leominster today is 85. Yesterday we were at 90, and the day before we were at 88. So we went from 88 to 90, and now we've dropped back to 85. And now 85 off of isolation, 84. That's the number I was looking for. This may not mean anything to you, but that's the number I was looking for. That's a total of 169. Yesterday, again, we had 90. Now, this doesn't mean we're to the end, but I was just looking for that day when the number of those that are active and the number of those coming off meaning removed, meaning they've been are not showing any more symptoms. So 85 active, 84 off. Is this a trend to come? I don't know. We'll have to see this week. But that would be good news if those equal out, because that's pretty much beginning to level out. Then the next step would be, and maybe this week, that's what happens, they level out, and then maybe next week they start to go the other way. So I don't know, I'm just trying to be hopeful and optimistic about that. And you know, we're right about 85 and 84 today. That's the first time that it's happened. Either it's always gone either way. So this time we've dropped down 5 cases, could mean nothing. We could spike back up to 100 active cases tomorrow and less cases off, but we'll have to wait and see. So that's the update on what's happening here in the city of Leominster. Thank you. There have been some people who have been absolutely great. The reason I keep doing it is people have said that they enjoy the information, they appreciate it. It cuts down on the number of times that they have to call for other information. And again, I'm just going to close out with, if you're having any issue at all, do not feel so proud that you don't need help. These are tough times. None of us have experienced anything like this. Call us at City Hall. We're discreet. We don't share this information. It's kept to us. 978-534-7500, extension 0. There's nothing that we'd like to do more than to help you out. Also, at Emergency Management, 978-534-7500, extension 5055. We're out of time. Thank you, guys back there, Bradley and Keith, everybody here at LTV for making sure this happens. We also rebroadcast this on WLPZ 95.1, and you can catch them streaming at WLPZ.org, and then click on streaming. Thank you. We'll see you tomorrow morning at 9. Be safe, be kind, help somebody else out, be well.